The heart of the Telehealthcare system is the home unit, which automatically raises an alert from every Telehealthcare sensor and the personal trigger. When triggered, there will be an audible alarm, and at the same time, a monitoring sensor, carer or family member will be alerted. This is so that if the individual doesn't hear the alarm or they're unable to respond, someone else is made aware to make sure the individual is not left unattended. The home unit has the ability to generate different responses depending on the type of alarm being triggered. If the person has a habit of flooding the bath, then the flood detector can send an alert to a neighbour rather than the monitoring centre. This means the Telehealthcare service is built around the needs of the individual to create a solution that's unique to them. There may be occasions when an individual doesn't hear an alarm. This could be for a number of reasons. Maybe the television is turned on loudly, they may have a hearing impairment, or they could just be asleep. The MyLife X10 DDA adapter works in conjunction with the home unit to produce a unique response to an alarm. This could mean turning off the television to make it easier to hear the alarm, or activating the DDA beacon for hearing impaired people. One older person in the UK dies every 5 hours after a fall in the home. For many, a fall results in admission to hospital or a permanent move into a care home. Falls are usually caused by everyday items around the house, such as tripping over slippers or folds in a rug, or because of difficulty going up and down the stairs. Quite often, a fall causes an injury, and some older people are left on the floor for hours or even overnight. To prevent a fall going unnoticed, Tunstall has developed a number of Telehealthcare sensors. These include movement sensors, which can detect an absence of movement, which may indicate a fall. There is also a personal radio pendant, which the individual can press to raise an alert, or the fall detector, which will automatically raise an alert in the event of a fall. As 40% of people with dementia are prone to walking about, Tunstall's property exit sensor provides an early warning by alerting the monitoring sensor or carer that the person is leaving their property, particularly at night. Older people and those with learning disabilities are particularly vulnerable to bogus callers. Common scams include distraction burglaries, where a caller pretends to be from a utilities company to gain access to the house so they can steal valuables. In these circumstances, help is easily summoned by pressing the bogus caller button, which raises a call to a monitoring centre via the home unit. Hearing a response from the monitoring centre is often enough to cause a bogus caller to flee. But all calls are automatically recorded and are admissible as evidence in court. An alternative solution is the door entry system, which can be set up in conjunction with a standard television and home unit. This provides visual and audible identification of a caller, allowing the individual to decide if they want to open the door or not. Every year, fires in the home cause hundreds of deaths, and the damage to property is devastating. The wireless smoke detector will raise 2 alarms, the first to alert the individual and the second to the 24-hour monitoring centre. Because the alarms are automatic and immediate, the risks to life and property are reduced. 70% of falls occur at night, when people are unlikely to be wearing a pendant. Older people are particularly susceptible because of poor vision in darkness and slower reaction times. A bed occupancy sensor placed under the mattress has the ability to raise an alert if someone gets out of bed during the night and fails to return after a period of time has elapsed. MyLife X10 adapters respond to movement sensors or the bed sensor to automatically turn on lights gradually at night to minimise the risk of falling. Epilepsy is the most common serious neurological condition which affects people of all ages, many of whom have a learning disability. The epilepsy sensor monitors an individual's vital signs, and when a tonic-clonic seizure is detected, an alarm will be raised via the home unit to a monitoring centre or carer. In the UK, there are 2 million people with a visual impairment and 9 million with a hearing impairment. Tunstall's DDA solution combines a pager, transmitter and an under-the-pillow pad. When an alarm is raised, the home unit sends a signal to the pager via a MyLife X10 Plus DDA adapter. If a telecare sensor is triggered during the night, the pillow pad will vibrate to make sure hearing impaired people are immediately made aware of the alarm. A flashing beacon can be used in any room to alert hearing impaired people in the same fashion. Enuresis is common amongst older people and those with learning disabilities. Physical checks during the night are disruptive and undignified, but with an enuresis sensor, an alert is immediately raised when moisture is detected. If the telephone is in use, the safe socket allows the home unit to seize the line to ensure an alarm is raised, providing peace of mind. Identifying an early decline in a person's health is key to maintaining independence. AD Life builds up a picture of a person's daily living from telecare sensors around the home. These include movement sensors, electrical appliance sensors and door usage sensors, which can be on a food cupboard or the fridge. If the pattern of normal activity starts to move outside preset parameters, an alert will be raised at the monitoring centre. This change may indicate a decline in health or identify a particular problem that can be dealt with before it develops into something more serious. There are over 18 million people in the UK living with a long-term health condition, and this figure is set to rise in years to come. The result is an ever-increasing strain on healthcare resources as patients are frequently admitted to hospital. Telehealth offers a way of improving the quality of life for patients and easing the pressure on healthcare services by preventing hospital admissions and facilitating the early discharge of patients. A telehealth monitor allows a patient to measure their vital signs on a regular basis from the comfort of their own home. The monitor also offers a series of clinical questions, self-care advice and patient reminders to further determine their current condition. This information is then carefully analysed by healthcare professionals who take the appropriate action, which could be prioritising a visit or referring the patient for treatment. Cooking can be dangerous for people suffering from dementia and those with learning disabilities. Leaving pans unattended, forgetting to turn the gas off, or even placing electrical kettles on gas rings can be common occurrences. Known as the silent killer, carbon monoxide poisoning kills 40 people and injures 300 a year. Faulty appliances or a blocked flue are the most common causes. By placing a carbon monoxide sensor in the home, an alert will be automatically raised before dangerous levels of the gas are detected. The gas management solution is a combination of a gas detector and a gas shut-off valve. When a gas leak is detected, an alert is raised at the monitoring centre and simultaneously the gas supply is automatically turned off. The resident will also be alerted to the potential danger via an audible alarm. Smoke detectors ideal for hallways are too sensitive for the kitchen, which is why Tunstall has developed the temperature extreme sensor, which in conjunction with smoke detectors can detect a potential fire by the rapid rise in temperature. These would normally be placed on the ceiling, but when they're placed on the wall, they can also detect excessively low temperatures, which could lead to hypothermia. A household flood can cause significant damage, and a flood detector can minimise the impact it can cause by providing an early warning to both the user and the monitoring centre. The average person spends the majority of time at home, in the bedroom and the lounge. Older people in particular don't move around very much, and they may heat only one room to conserve energy bills. Carbon monoxide poisoning is lethal, but it can be easily prevented by using a carbon monoxide sensor. Gas detectors and temperature extreme sensors can also be used to protect the individual from fire-related concerns. To protect the property when an individual is not at home, door contact sensors can be combined with a series of movement sensors and a home unit to create a monitored intruder alarm. Personal radio triggers allow an individual to raise an alert from any room in the house, and with a 50-metre range, even a fall in the garden would be detected. Both triggers are discreet and can be worn on a neck cord or a wrist strap, and they can be adapted for people with limited dexterity. An alternative to the personal trigger is the Minuet watch, which is much more discreet. Almost 9 million people in the UK have a hearing impairment, and a large number of them are Telehealthcare users. The DDA vibrating pager is linked to a home unit which sends a signal to the pager when a sensor is triggered. The pager is charged in a cradle overnight, which is connected to an under-the-pillow pad. This will vibrate if an alarm is raised at night. The fall detector provides peace of mind for anyone concerned about falling. Worn on the belt or in a pouch around the waist, it automatically raises an alarm to a relative or the monitoring centre via the home unit. Sometimes people need reminding to take their medication and may need prompting. If the individual does not remove their medication from the dispenser, an audible reminder will be generated via the home unit. If the user does not access their medication after a set period of time, an alert will be raised with the monitoring centre and the appropriate action can be taken. Caring for someone is no easy task, and the responsibility of someone else's welfare 24 hours a day, 7 days a week, whether it be family or a friend, can be physically, mentally and emotionally draining. Carers often feel invisible, isolated, and that there is no support available. By introducing Telehealthcare into the home, it can reduce stress and anxiety for not only the person being cared for, but also the carer. It enables them to sleep at night and take regular breaks during the day, knowing that help is always available. The bathroom is one of the most hazardous places in the home for older people. Falls during the night or getting in and out of the bath are common and can lead to serious injuries. Personal triggers can be wall-mounted close to the ground so the user can call for assistance if they fall. By combining data from sensors around the home, virtual sensors produce more intelligent alarms. If the individual spends an unusual amount of time in the bathroom, this may indicate a fall or that they've got stuck in the bath, and an alarm will be raised. Short-term memory loss is a symptom of dementia, and some people with learning disabilities are easily distracted. Taps can be left running and floods are a fairly common outcome. If a sink or bath overflows, the flood detector will raise an alarm, alerting both the individual and the monitoring centre.